glad. My question is, all the women in the group have had an initial diagnosis and then they've had a secondary diagnosis of metastatic. Is there a scientific reason why a small group of people with cancer then go on to get metastatic cancer?
Well, it's quite a complex topic. There's a lot of different mechanisms and there's a lot of research into why and how, and it certainly is not a one sort of mechanism how it happens. We know that some people, for example, will have a recurrence while on adjuvant treatment. Some will have as soon as they stop adjuvant treatment. Some will have years after they finish the treatment, and it's a all different sort of setting for each of those situations. So for some that they will develop recurrence while they're on adjuvant treatment, the cancer has developed resistance, and there was either more aggressive biology or a higher volume of the cancer cells that had the time to learn how to deal with the hormone treatment or any other adjuvant treatment that we give after the diagnosis of early breast cancer. That's certainly more difficult and complex situation to deal with, because we know that we already exhausted at one line of treatment and we can't use that, and we're looking to find what exact mechanism is why the cancer has become resistant. That's when we tend to do biopsies at the time of recurrence to see whether, for example, a ER positive disease is turned into triple negative and then totally lost the estrogen receptors and just using completely different driver to grow. Or maybe it's still ER positive disease but it's developed a specific mutation like the PI3K, which then will require a completely different treatment. The other patients that have had early disease years down the track, years before they got a recurrence and they finished the adjuvant treatment, they're likely to still be sensitive. It's just that the adjuvant treatment hasn't killed all the cancer cells. We know that some cancer cells will go into a state of dormancy, sort of they just go to sleep, they don't divide and they become resistant, they sort of just close in their shell and no drugs will touch them. And then years after the treatment's finished, they'll wake up and they start growing again. Those cancer recurrences can be treated usually with the same drugs that we used before, and we can still have some efficacy. And then there's the third group, which may just have completely new disease, new primary, especially someone who has BRCA, might have just an occult cancer that has spread from other side, from the other breast, and it's totally different disease. In general, we will aim to do a biopsy whenever we deal with recurrence, because we need to test the biology and see what sort of the disease we're dealing with. It may not necessarily be the same cancer that we dealt with the first time. Cancers tend to learn, so whatever we throw at them, they will adapt, and they will learn how to deal with it. The ones that, it's like an evolution, the ones that don't adapt, they will die off, but the residual cells will just become smarter and multiply again and take the place of the ones that we killed with the cancer treatment before.